Hi, I'm Dr. Tom Schell. This is Microbabe, an 8-year-old, I believe, thoroughbred mare. Last time she raced was in 2013. She was picked up by a rescue, brought down to us for rehab purposes. Her story is that she had raced. She was picked up in the killer pens by the rescue. She had an injury to her left rear. Really don't know what the story is in terms of the injury itself, but it resulted in quite a bit of cellulitis or swelling to the left rear limb with associated lameness. And here's some photos looking at the way she presented to us when she first came in. Okay, so we're back to Microbabe. She has been in our facility for about a week right now. We've had her on some Cur-OST formulas as well as sweat wraps to try to bring the swelling down. This is where she stands right now compared to the original photos. We do have a little bit more definition and detail here through the cannon bone region. We can actually make out the fetlock. She still has a nice capped hock there. This swelling is edematous, meaning that if I push in on it with my thumb and my finger, I do leave an indentation, although right now the indentation is much less than what it was when she first came in. She is walking fairly well on the leg, but due to the swelling, she is mainly landing on the toe and then heel, and she's fairly reluctant to put complete weight on the heel when she's moving at a fairly fast clip. I'm not sure if we can make out in the video or not here, but she's got a large area of scar tissue, almost like a laceration. Step out of the way. That's actually raised right over the lateral or outside aspect of the fetlock. Again, we don't know what the cause was to her injury, what led her to this. It could have been obviously something traumatic. She could have been kicked. We really don't know. Therapies for her and this injury and this whole area of swelling has been going on, I believe, for a little bit over a year right now. And she's been treated at the university level with regional limb perfusions, systemic antibiotics. I believe she even had surgery here at the level of the hock to drain the fluid as well. But she's been through multiple therapies. Nothing has really brought complete resolution to her problem. But right now we are standing a pretty good chance of getting her to come around. But the biggest problem we have is because of this injury, I believe we've got some scarring there in the flexor tendons. She's not really wanting to trust this leg completely, but the swelling is coming down nicely at this stage. And again, we're about a week into therapy. Here's Microbabe. We're about a week and a half into therapy. When she first came into us, she was essentially non-weight bearing on the left rear. She would toe touch to move forward, but essentially non-weight bearing. So here, a week and a half, she is doing quite well using the leg. She is still a little bit hesitant about the heel and putting complete weight back there. Here she is at a lunge. You can see that she would prefer to go three-legged, which is actually quite impressive, but she will drop the leg down and use it at a walk. And here we are 3 days later. At the trot, you can see that she's obviously using the leg. She certainly does have a hitch to the left rear, but she's using it much better than what she was 3 days prior. Daily PT, light lunging with her was essential because we had to try to restore range of motion in these joints just due to the scar tissue and tightening around the joints due to the chronic cellulitis. So movement with her is a very, very good thing. Okay, so here we are today at 2-week mark. Microbabe again here with the left rear cellulitis due to injury of unknown cause. She's actually doing quite well. She's about 90% sound at the walk. She does have a hitch on the left rear at the walk. We've actually done daily PT with her. She's on a lunge line, moving fairly well considering that 2 weeks ago she was non-weight bearing for the most part on this leg. If we zoom in on the leg itself here, overall swelling's come down probably about 40%. We have a little bit more definition, a little bit of a waistline here to the cannon bone metatarsal region. It's still a little bit edematous, certainly not as much as what it was 2 weeks ago. She does have a very large scar here again. We don't know what the cause was. Her daily regimen has been, she's been on our EQ Total Support product, she's been on our immune product to help boost the immune system, get this resolved. Looking at her when she first came in, We did analyze her feces. She does have a really high count of what we call as lactobacillus, which is often associated with certain hindgut problems and inflammation in the horses. So we addressed that. The cause with her with that, and a lot of the race horses, just due to the high carb levels and the medications, the anti-ulcer meds that they're on, they tend to have a higher lactobacillus count. So our goal is to try to reverse that and get that back. So we have been managing that through the supplements as well, just trying to improve the hindgut. We've moved her over to a whole grain diet, basically oats and barley, just trying to keep things as pure, as natural as possible, trying to improve the health in the hindgut. And as we improve the health in the hindgut, this starts to come around. So she's doing quite well. No medications at this point in time other than a general antibiotic, SMZ TMPs, which we've had around for about a week right now. She came to us with a history of long-term antibiotic use, enrofloxacin, doxycycline. She had regional limb perfusions done. Nothing was helping. And again, the only way to really try to get this to resolve itself is to try to improve the hindgut. So she has done quite well. Hopefully we can get her back to her rescue group up in Virginia and continue to keep her on the mend with some daily PT. Long-term prognosis with her is pretty good for a pasture horse. I really don't know, just due to scarring here in the hock and the fetlock, how much range of motion she's going to get back in the region, but she's certainly more comfortable than what she was 2 weeks ago by far. And hopefully with continued rehab and supplementation and diet, she would do quite well. So we'll be sending Microbabe back here shortly and go from there. Thank you.